With me now is Vicki Kaiser from the McLeese Clinic. Vicki, welcome.
Thank you.
And thanks for this wonderful event that you're a part of.
Thank you.
And tell me, where is the McLeese Clinic and what do you do?
The McLeese Clinic is located in the old Cancer Center at Hackley Hospital on the south end. And what we do at the McLeese Clinic is we are the HIV clinic in Muskegon that takes care of all those people who are infected with HIV.
Okay. And as Phil was telling me, that we'd like to think that we don't have that in Muskegon County, but of course we do, and unfortunately it's on the rise, as I understand.
Yes.
Not an epidemic. But
It is not an epidemic. Proportionately in Muskegon County, it's probably not at the large scale like on the east side of the state. However, we do take care of people that come from 14 different counties around western Michigan. Our active client list is about probably 134 clients right now from 14 different counties. So.
14 different counties. And what we want to do is prevent anything from becoming an epidemic. So we're all about wellness and prevention here.
Yes, we are.
Okay. So tell me, what did it take to put this event together? You're part of that planning?
Yes, I am part of the planning. We usually have monthly meetings at the McLeese Clinic, actually, to plan different activities for prevention. We did National Testing Day back in June. We have this function now for our meet and greet, and then we'll do World AIDS Day in December 1st, which is World AIDS Day.
Okay. And on World AIDS Day, do you offer free testing again?
We will be offering free testing that day at the First Congregational Church in Muskegon. I believe it's located at the corner of Jefferson and 3rd. They have a Saturday morning breakfast that they invite the community to, and we will be doing testing there that morning. Also, there's an event going on, I believe, at Baker College on the 31st of October, and I believe we will be doing testing there between 10 and 2 that day.
Okay.
So.
Okay. Well, Vicki, I want to thank you so much. Phil's starting his speech, and I'm hoping we can catch a little bit of it.
Okay.
So thanks
Thank
a
you.
lot. Welcome back, West Michigan. You are watching Alive and Well, and we are at the Red Meet and Greet event, which is HIV awareness fundraiser. Your hostess with the mostest was feeling a little too mostest and exposed, so I did change, but red is the color tonight. With me is Sheila Wilson from Public Health of Muskegon County. Correct. Sheila, tell me about your job at Public Health.
I work in the STD HIV division of Public Health with the communicable diseases, and we do offer free HIV testing all week long, Monday through Friday. And there's a real advantage to people coming to be tested at the health department because all the nurses there that do testing go through training at the state of Michigan, which is really nice. So we do pre-test counseling and post-test counseling, which as if the doctor tests, which is great to be tested through the doctor, but you wouldn't get that same aspect. You wouldn't get the education and the stuff that we discuss. So that's a real advantage. So anyone that wants free testing of HIV, we can do it a couple of different ways. And they can be done from 8 in the morning until 10:30, and then from 12 to 4 o'clock, Monday through Friday.
Monday through Friday. That's very good to know. Okay, so now can anybody get free testing? Do they have to do an income qualification?
Oh, no. Anyone can come in. Yeah, anyone that's 13 years old and older can come in for testing.
Really good information. So if they're over 13, can they come in without a parent consent?
They sure can.
Good to know.
Yeah.
Good to know. Are you listening out there, parents and teens? If you are over 13, you can come in without your parents' consent and get tested, and better safe than sorry. Okay. So how long have you been doing this, Sheila?
I've been doing public health for 12 years now, and I really enjoy it. I have 30 years of nursing experience, so this is great. I kind of left for a little bit and came back because I liked it so much. But we also give free condoms away, which is quite important for protection, unless you're going to practice abstinence, which is the only 100% way to protect yourself from being infected.
And please, we really promote abstinence is the way to go, but we do know that not everybody is practicing abstinence. And so in reality, if you're going to be unprotected, don't. go to Public Health and get condoms, or have some just in case. If you're a young person and you think that might be coming up, don't be embarrassed. This is the place to go where they can make you feel comfortable, not embarrassed. Don't think twice about it. If you're thinking about having sexual relations, you should be smart enough to not be afraid to come down and get some condoms. I guess that's the best way I can say it.
Yes. And anyone can walk in, 13 years old and older, and walk into the main counter. They don't have to give their name or anything. They can just approach the desk and ask for condoms, and they'll get free condoms. And again, with the testing, anyone can come in and just ask to get free testing. And then they'll go back to the clinic, and the nurse will see them and do the testing. So it's really nice. So we offer rapid HIV testing, which they can actually, it's just a finger stick, and in 15 minutes they can get results. We can offer the serum blood draw, where they draw blood from the arm, and it takes about a week to get results. But at this time, we're not offering the OraSure swab test in the mouth. On occasion, we'll get some of those tests, but
Are
yes.
they equally effective for testing?
Oh, yes, very effective, very effective. All are very effective.
I know when they do a lot of the free testing, they quite often offer the swab test. It's the easiest way to do with large groups. So it's good to know they're effective. And as Phil told us earlier, that young women, African American women in particular, between the ages of 13 and 25, there is an increase. Not a huge increase, but there is an increase in HIV. So it's important to get tested. And you also offer education programs, and then there are other things other than HIV to be concerned about. And some of those are chlamydia, which is on the rise.
Yes, actually, Muskegon County is still one of the leading counties in the state of Michigan with the highest chlamydia rates, unfortunately. And a lot of people don't have any symptoms at all. So they wouldn't really know they were infected unless they got tested. So.
Or if they were with a partner who may have reported that they were with them. So yes, it's scary. We know it's scary. But just about all of these things are curable, and those that aren't curable can definitely be, I can't say prevented. Yeah, everything can be prevented. But if you are diagnosed with HIV, it's no longer a death sentence. You can live with it a long, healthy life as long as you get in there and get tested and get
Right. Yeah, and anyone that tests at the Public Health Muskegon County, we also offer, with the post-test counseling, anyone that we find to be infected, we have an agreement with McLeese Clinic where we offer to get them hooked up with medical care right away. So that is very unique, and that has been really nice to have.
Yeah, I know. That's wonderful what we have here in Muskegon County with all of the different organizations that work so well together. And we're so thankful to have public health in your services. So thanks a lot,
Thank
Sheila.
you.
Pleasure to meet you.
Thank you.
Thank you, Muskegon, for watching tonight. And I hope you've enjoyed our Red event. And yesterday, our talks about the breast cancer awareness, also offered at Public Health. Lots of education going on out here in the community. And don't be afraid to either come down to the Muskegon Community Health Project, Muskegon Public Health, the McLeese Clinic, wherever you need to go. Benson Drugs, we're all here to help you. So thank you for watching. And if you have some ideas for another show, let me know.